Dr. Carlisle is a very humble man. He is a scholar, and it's been a pleasure to be able to see him over the years develop his voice, and his voice has been one of passion and commitment for the community.
I met him when he was up at the state as the director of the Office of Statewide Health Planning and Development. A brilliant man in his own right, a physician, someone who does a lot very quietly on the side for communities.
When you walk into a room and there's many smart people there, he could be the smartest man in the room, but he's not jumping up and down and showing that. In the end, he's leading by example, and I think that example of humbleness, a very keen intelligence, and the desire to do the right thing for everybody really makes him a healthcare leader.
He was appointed as the Director of Office of Statewide Health Planning and Development by Governor Gray Davis, and actually he served for, I think it's about 10 years through the Davis administration and then through the Schwarzenegger administration. That's pretty amazing because he was able to bridge both a Democratic governor and a Republican governor.
Here is someone who has taken California light years, I think, ahead of the rest of the nation in terms of really examining what's happening in our healthcare system. What is the impact on communities? Are we making a difference in the lives of people? Are people living healthier, longer lives? And has used data to tell a story that many of us could never be able to tell, with 1,000 words.
As the vector, I was a National Service Corps scholar serving my 2-year commitment in the Watts Health Center in the Watts region of Los Angeles. And during that time, I essentially underwent a conversion from being a hospital-based physician who was really good at doing anything in the hospital, any procedure, handling it all myself, basically, to a physician who was versed and oriented to the needs of outpatient populations. And I soon became exposed to the idea of population medicine and started to see that through public health techniques and population-based practices, one could alter and improve the health of literally hundreds and thousands of individuals at one time versus my previous work as a physician where I might see one patient at a time and alter that one patient's and improve that one patient's health one at a time. Then I'd go on and see the next patient.
Dr. Carlisle is the right person at the right time to inspire the community to a state of wellness, because he's here as a physician, as a scholar, as an educator, and he's bringing all of that together, and he's able to inspire students to really see a vision in which they can do research that furthers and betters the health of the community.
My vision would be a healthy community where people don't have to take buses for several hours to get medical care, where care is available for mothers with feverish children at 2 o'clock in the morning, where one has an emergency room, a trauma center in proximity if one is the victim of a crime, for example, or an accident. I'd like to see a vision of South LA where healthy lifestyles are encouraged, where one can find healthy food available, farmers markets, not just being dependent upon fast food outlets and liquor stores, for example. And that would be my vision for South Los Angeles. I feel very personally connected to my community. I've had relatives live and grow up here. I still do. And I would like to see a South LA that can offer as much as the other parts of Los Angeles to its 1.5 million residents.
Sometimes you can work a lot of hours and have a heavy load, but there's always something more you can do, and he exemplifies it on many levels, that he just takes on things and does them and is very good-natured about it and doesn't really think twice about, is this too much for me to do, or am I busy? He just says yes.
I'm a volunteer at the Venice Family Clinic, and one of the nice things that I see is that patients are always greatly appreciative of what I offer to them. And I'm usually seeing them free of charge as a volunteer. The patients are usually so poor that they can't afford to pay anything to the clinic whatsoever. And I look at them and I basically say, this is the same population that my family came from. It means a lot to me. And I'm just proud to be able to provide those services for a population that needs them.
he has a deep sense of caring for his family, his friends, but he extends that caring to others that he doesn't even know, and that's what makes him an outstanding physician.
He has held our healthcare system to a higher standard of care, and I think that we owe him a great deal of debt.